morning. I am Dr. Kambete, Vice President, Shalby Hospitals. Today I am going to interview Dr. Bharat Gajjar. I am going to ask him about joint replacement surgery. Dr. Gajjar, what is arthritis?
Arthritis is a degeneration. It's like aging process. When you grow up, like in old age, you have a cataract, you have arthritis. It's a degeneration. It's not a disease. It's a problem.
What are the treatments for arthritis?
Look, it's like cataract. Solution to cataract is once you have developed cataract fully. Solution to cataract is put a new lensing and remove the worn out lens. Same way, you can replace the worn out cartilage with a new joint that is known as surface replacement or total knee replacement.
Now, is it possible to treat painful knees and hip joints without surgery?
Sir, I told you it's not a disease. Disease can be cured. Disease as a treatment and problem as a solution. So, whenever there is a problem, you have to get the solution of it. Either you can avoid it or you can solve the problem. But important in selection of hospital is the infrastructure and the teamwork. Basically, it's not a one-man job. It's a whole team. Synchronization of all team members can make this surgery successful and result-oriented. Whenever you plan for surgery, first thought that comes in your mind is who is the best doctor. That is number one. What is best? So, his experience, expertise. And infrastructure should be like that. Anything goes wrong, it can be treated properly to prevent infection. The hygienic. Normally, the good hospitals means good operation theatre environment. Yes, because we are dealing with aged people. So every problem they have, all the systems are working at a lower level. So if anything goes wrong, they don't cope up in crisis. So we should be having a proper backup so that any system gets problem, it can be treated within the hospital under one roof.
What is the best time to get a joint replacement?
There is nothing like best time, I think so. Whenever you think that you want to get rid of your problem, you should get it done.
So, in case there is a lot of pain in the knees, the earlier the better.
Your earliest convenient time, I would say. It is not a life-saving surgery.
Suppose I don't get surgery done and continue with physiotherapy or tablets or how would it work out in my life?
It never works. Day by day your level of efficiency goes down. When your walking goes down, or all the systems will work at a lower level. That includes cardiac, neurological, everything. So walking is important not for the knee, for body itself and all other systems of the body like heart and brain and everything.
Supposing I get operated, how much time will it take for me to resume my daily work and routine?
Routine, you can start working in 15 days time, but you are on your own on same day or second day maximum. Recovery depends from person to person. Those who have set target, they recover fast. Likewise, male patient doesn't want to be on home, so they recover fast. Females, they don't want to go out of home. Partly they have attention sickness problem, so they may take longer time, but it cannot be more than 1 month.
In our Indian culture and tradition, many times we have to sit cross-legged. Now, is it permitted after joint replacement?
You can sit cross-legged at a higher surface, not on the floor. Logically, if you can sit at a higher surface, you can always sit on floor also, but why not? That everybody should understand. While getting up, you are putting more pressure on the joint. So we are reducing the life of the joint, which is expected of say 20 to 25 years.
Can a joint replacement patient sit on the floor?
They should not. They can, but they should not.
Which joint is usually used for joint replacement surgery?
That is to be decided by surgeon. That's what I feel.
What is this zero technique?
Zero technique is an innovation of Dr. Vikram Shah. Any surgery can be painless, but it is less pain. Physiotherapy, hardly to save the life, that is to move ankle pump exercise. I would not tell it as a physiotherapy. So that also is almost zero. Third thing, recovery. Usually people take 45 minutes to 1 hour. This surgery being done by Dr. Vikram Shah takes 10 minutes. 10 minutes doesn't make any difference to patient, but lesser the time of surgery, tissue handling is good. Good this tissue handling, recovery is faster. Patient starts walking in 2 to 3 hours after surgery once they come in their home. So all the things are coming on positive side. We don't have to put urine catheter or any drainage tube for blood or so. There are all the chances of infection that we are trying to avoid.
Supposing I get a knee replacement done, what should I do to make my joint last longer?
You should use it wisely. Wisely means don't sit on floor. Except sitting on the floor, you can do everything which you want to do, which you are able to do.
Why do patients prefer Shalby hospitals for joint replacement from all over the world?
I think it should be asked to the patient only. But one satisfied patient would tell 10 people that look, this is the best place. To my experience, once patients are admitted, they don't feel that they are in hospital.
Dr. Gachar, you have been associated with Shalby Hospital since a long time. What is your experience about it?
When we started, we have never ever thought of that our patients will take us at this level, but only because of our dedication to the profession, honesty for the profession, and ownership of our patient that we take, that has brought us at this level.
Do you think Shalby Hospitals is now famous only for hip and knee replacement surgeries or?
Since 2007, when we started at Karnavati, opposite Karnavati Club, it is a multi-speciality hospital. And it was a requirement of this total knee replacement or total hip replacement patient. That's why with that concept, Dr. Sai started this hospital, that our patient may require anything during their hospitalization, then it should be done under our observation only.
Shalby Hospitals does nearly 7,500 joint replacement surgeries a year. What do you think is the secret of this phenomenal success?
Only result. Success of any surgeon depends on result only. I am still repeating, nobody loves Vikram Shah, nobody likes Vikram Shah, only result. Results of Vikram Shah. Surgeon who has done highest number of replacement in the world as of today.
How was your experience in working with Dr. Vikram Shah so closely?
I have no words to express it. But I am with him since 21 years. To be with a person for 21 years, it has to be a good experience.